This is where we have the hard conversations, empowering family members to deal with the things that they walk out of hospital with that was not written on the discharge report. I am Ilani Creel, and this is Fill in the Blanks. This is where we have the hard conversations, empowering family members to deal with the things that they walk out of hospital with that was not written on the discharge report. So in February, we're focusing on going home with incurable diseases. So the moment we say incurable, we need to clarify that language. Because when someone is terrified, it is important to understand what it means. So when we talk about incurable diseases, it takes one of two forms. The first one that might spring to mind when you say incurable can be someone that's diagnosed with stage 4 cancer and they've got 6 months left to live. The oncologist tells them, there's nothing left that we can do for you. Go home and enjoy your last days. That's the first thing that springs to mind when you think incurable. The second one that doesn't always click immediately is a person who sustained a stroke or a spinal cord injury or a traumatic brain injury or is diagnosed with Parkinson's disease is also an incurable disease. So what incurable disease means is that no amount of surgery, medication, or medical intervention can reverse the diagnosis, can better the prognosis, and can change the end. Incurable means that once this diagnosis has been given, this is something that this patient will live with for the rest of their lives. And depending on the nature of the incurable disease, that is where the timeline will differ. So today I want to share 4 things with family members when it comes to incurable disease. The first thing is there is a big shift in the before and the after. Usually, a loved one goes for a general checkup. You realize something is wrong. Families often think, no, it's only something small. Let's just take mom to the doctor and everything will be fine. Just to be referred to a neurologist and get a diagnosis of advanced Alzheimer's or dementia. Life before that conversation and life after that conversation is completely different. And often family members stand in the middle trying to cope with things that were before and things that were after. So a thought that I want to share is it is normal to feel like your life has changed within one conversation. You cannot walk out of that doctor's room or be discharged out of hospital when the oncologist told you that your wife has 6 months left to live and continue with life as normal. Sometimes families do that because there is a space for a little bit of denial. But in the end, you are taking away and you are depriving yourself and the patient, who's your loved one, of the meaningful time that you have. So make time to actually come to terms with this diagnosis. Understand that there is now life after diagnosis. And now the focus shifts from we're going to do everything that we can to get a cure, to buy time, to shifting towards every single day matters. It doesn't matter how many days we have. That is a complete shift in how you approach caring for someone with an incurable disease, where there's meaning, where there's quality of life, and where there's wholesome relationships. But that is a decision that loved ones need to make. The second thing I want to share is that there is an emotional roller coaster. So it is wise not to try and just be okay, to just cope emotionally. It is important to understand that there is an anticipatory grief, which means that you are already grieving someone who is still alive. You are grieving the life before the prognosis, the life before that difficult conversation. And that can sometimes be very confusing and very complex when the person is still here. But when we understand that this is a phenomena, that this is something that happens, you as a family can reach out for counseling, for support, and go through this process. The anticipatory grief can often include feeling angry, feeling heartbroken, being in denial, feeling like I cannot cope with the reality of this. So that is all part of this anticipatory grief process. But the gift that this anticipatory grief brings is it allows you to come to terms with making meaning in the now, shifting towards quality of life, spending every day as the last day, and just loving your loved one. Because when it comes to incurable disease, it doesn't mean that your loved one is uncareable. It is during those conversations in hospital where the doctors tell you there's nothing left that we can do, that there's still a lot that matters. How your loved one wakes up in the morning matters. The inside jokes that you guys have matter. The things that they still enjoy is still valuable. So even though a prognosis is given that there is only a set amount of time, that there's nothing they can do to take away this illness or disease, that doesn't mean that your loved one can't have dignity and quality of life. And for families to really come to terms with that shift in, we're not going to try and do everything we can to prolong life, but we're rather going to try and come to terms with the situation, control the controllables, and make the most of every day. But understanding that there is an emotional storm, that there is an emotional process of coming to terms with this. This is very valuable for families to understand. The third thing I want to share is often when a loved one is diagnosed with an incurable disease, they often have physical, cognitive, meaning thinking, and emotional care needs from there out. So I'm specifically thinking about that diagnosis of stage 4 cancer, about the diagnosis of end stage or advanced stage Alzheimer's or dementia. Often that loved one is discharged from hospital or goes from the specialist appointment needing some care. The most important thing is to get the right care plan in place. Whether that is making use of a service provider like us at Creel Care Specialists with functional care, where we bring a care partner in to facilitate activities of daily living and promote dignity and quality of life, or empowering a family member to be a care partner, or making use of services like your frail care centers or home nursing services. Get a care plan in place, because usually your incurable diseases are also progressive, which means that they get worse over time. We are going to link a discharge planning and care plan checklist in the bio that you can have a look at what is important to have in place when your loved one is discharged from hospital. Understanding what medication your loved one is taking, understanding what their care needs are with regards to bathing, grooming, dressing. Are they able to eat a normal diet, or are they now on a soft diet? Are they able to drink normal fluids? Do they need a thickening agent to stop them from coughing? These are all very important things to take into consideration in the care plan. So make sure that you have the care plan in place. And then this is specifically for our audience that need to have their loved one discharged from hospital. The first 72 hours is really the most traumatic. You are very uncertain about what they expect from home, especially if your loved one has a serious condition like they sustained a stroke or they have end-stage cancer. Usually families feel very uncertain about administering medication that they can't even pronounce, about making sure that they've got all the necessary supplies, like do we need a hospital bed, do we need a wheelchair, do we need a commode, what about gloves, linen savers, nappies. So make sure to speak to someone that can help you and advise you in that regard. Usually, with a serious condition, being discharged from hospital, the first 72 hours is also the time frame where patients are rehospitalized. So it's important to have an emergency plan in place. At Creel Care, we implement an emergency plan where the caregiver needs to report any abnormality proactively, and then we have a protocol in place. Which hospital is the patient taken to? The medical details are written and visible. We know which family member to contact to inform them that there is a change in functioning, but the first 72 hours is usually the time where a patient is rehospitalized. So I do want to normalize that. If you take your loved one home and they are rehospitalized within the first 72 hours, that is not an uncommon phenomena. So be calm as family to understand that these things do happen. And then last but not least, this is for the family members specifically. So family caregiver burnout is a real thing. Having gone through a whole process of taking your loved one to doctor's visits, having them be admitted to hospital, going through some form of treatment, being discharged from hospital, taking them home with a care plan, and that is actually only the beginning then of the process to the end, no matter how long it takes, can take a huge toll on family members physically, emotionally, financially, and mentally. So I do want to encourage family members to really take care of yourself. That is not a selfish thing to do. Taking some time off to refill your cup is something so necessary to be able to continue caring for your loved one. So make sure that you take care of your physical needs, that you take care of your emotional needs. Make sure that you speak to someone that you trust, whether that is a counselor, a psychologist, a trusted friend. The research shows that family members who have a good support network often cope a lot better with the impact of a loved one with an incurable disease. So make sure that you as a loved one have the necessary support to go through this day by day. Make sure that you still get around to the things that you enjoy that fill your cup. So going to have a cup of coffee on a Saturday morning with a friend is just as important as making sure that your loved one has nappies and gloves and a care partner and food in the house. Without you taking care of yourself, making sure that you are healthy and productive, your loved one isn't in the best hands that they can be. So family members, I know that this is tough. I know that day by day you still need to go to work, care for the kids, make sure that all the errands are being run, that electricity is paid, that food is in the house. There's still a whole life to live while caring for your loved one with an incurable disease. But you also need to look after yourself. So these are the 4 things that I really want to encourage family members to remember. From a physical, emotional aspect, as well as making sure that you have support in putting a care plan in place and understanding that you are already grieving your loved one. And that makes it complex, especially when they are still here. These are things that sometimes doctors are too scared to say out loud, or therapists don't think to discuss with you, especially when your loved one is still in hospital. But these are the hard things that you might possibly be lying in bed at 2 a.m. in the morning, Googling because you don't know where to go. You don't know where to turn for support. And that is exactly why I became a social worker. I've sat with countless families in this position, just not always knowing what to say, but just being there, just answering questions, just brainstorming the way forward. And this is why I started this podcast, just to allow families just like yourself watching this podcast to know that you are not alone, that there are countless people going through something similar, and that there is someone who understands and who's willing to help. So as a final thought, I want to leave this with you. Family member, you are doing better than you think. I know that you get up day by day, you are exhausted, you are overwhelmed, you're not always certain what the right course of action is, but you are doing better than you think. Take it day by day. Be kind to yourself. Make sure that you fill your cup. and we are right here if you need us. You are welcome to reach out for a cup of coffee or a conversation, and we would be very happy to help. This is Iloni. This is Filling in the Blanks. This is where we have the hard conversations that people are not always willing to have. Tune in same time, same place next week.